Hi, everyone. I am Christine Doss. My pronouns are she, her, and I'm the Senior Program Manager for Health Policy and Management. And we are here to talk to you about our two-year MPH program for this particular session. And just a great shout out and kudos to Yesenia for answering questions in the chat about funding and doing a great job at Snapshot of funding, and Lori for talking about the SOFIS application, and Derek for jumping in the chat with some questions, because I didn't want to answer those questions. So thank you for all three of you for doing that. And Lori, if we get the go ahead, we can start our session. I think everyone can see my screen.
Yep, you're all set.
Thank you. So really quick agenda. We know we don't have 5 hours to spend with you, but we're going to provide as much information we can in the next 10 minutes or so. So we just provided a welcome of where the program staff here. We're going to go into a little bit of the key faculty and staff, very brief overview of our two-year health policy management MPH. What you're really here for is insights into the application for fall 2025. We're going to go over some snapshot of admission statistics and our current cohort profile. We'll provide some contact information, who to ask for what. Lori provided a lot of that before, but there's contact information specifically for HPM, and then hopefully we have time for some questions and answers. So let's get started. So Norma and I just introduced ourselves. We are the staff for HPM. So that's the acronym I'm going to use for Health Policy and Management. You'll get familiar with Berkeley acronyms as you go through the application process. But these are our three key faculty here on the screen. Jamie Robinson is our division chair and teaches a few of our policy courses. He's in health economics and policy expert. And then Kim McPherson is our faculty director, and she teaches our healthcare finance course. You'll see her name throughout a lot of our application material and our handbook. And then we were very fortunate to be joined by Robin Flagg, who is specifically supports us in our practicum placement and support for the HPM field internship or practicum requirement. She is an alum of both our MPH program and our health policy PhD program. So we are very fortunate to have in-house support for all of our students in our MPH program. And some basic overview of the two-year program specific to health policy management. Similar to most of the other MPH programs offered by Berkeley Public Health, it is 48 units minimum. That is over 4 academic semesters. So we are on a semester system. It's fall and spring. You do your practicum in the summer, then you come back for another fall and spring. And then we also have a capstone, which is your culminating paper and presentation. We'll get into a little bit of that more. And that's completed in your the final spring of your second year. So basically your final semester. All students at Berkeley Public Health and the MPH programs take the core curriculum. They're listed here. You'll see health policy management is on the core curriculum. Students in our program will take this as a seminar and a foundations class. So you'll get a little bit more meat in that breadth course, specifically with HPM. But everyone takes these classes. There is a new leadership and professionalism requirement, part of our accreditation. And one unique aspect to HPM is that you will actually satisfy this by taking a few of our classes. It's built into our curriculum. It's been built into our curriculum for a while before it was required for accreditation. So another benefit of HPM is that we're ahead of the curve. And so you'll get a lot of leadership and case studies and working with real life clients in some of our classes. And then what distinguishes HPM from other concentrations? We do get that question a lot. Why should I go for HPM, or should I apply for health and social behavior or environmental health sciences? And here on the screen, I'm not going to read it, but the recording will be made available, is these are our core competencies specifically to health policy management. So everyone will take core classes in management, finance. There's policy. We have quite a few different policy classes to choose from, and economics. So everyone takes a class that focuses on one of these competencies. And then our curriculum, these are the actual classes that you'll take. Again, there's a Foundations of Health Policy Management that's unique to HPM. That's our breadth course. And then you'll take a strategy class. We have organization behavior management. That includes the leadership component. There's finance, health policy. We actually have 6 classes you can choose from to satisfy this requirement. So if you're interested in global health, we have that. We have another course in biotech innovation policies. There's lots of different options to take. And then we have a few different economics courses and an analytic methods course, which is a more advanced quantitative analysis course than what you would get in epidemiology or biostatistics. And then our final HPM capstone course. So you do get credit for completing a capstone. And then electives. So what do you do to fill in all the other units that are required to get to that 48 minimum? And here's just a sample of popular electives taken by HPM students. These are offered in Berkeley Public Health. Students can also take classes outside of public health. Haas School of Business is popular. There's a few students that take classes with Goldman School of Public Policy or even law. So there are lots of options to take electives. And some of those electives can get you even bonus programs and a graduate certificate. So if you take enough electives in some of these areas, you can actually get a certificate. Health management is one offered by us, by Health Policy Management. So you can complete that in addition to earning your MPH in Health Policy Management. That's been very popular with students in other concentrations. And then a brief overview of the capstone. It's also could be referred to as a master's paper or a thesis. It's actually a little bit different than a thesis because it includes a oral presentation. And you might see this as a culminating experience in other programs, but you will select for your paper one of the 3 competencies here that you will get in all the courses. It ties into the MPH competencies and the HPM competencies that I showed in the earlier slide. You will be assigned 2 faculty readers that are within health policy management or public health. And it is a written report that you will submit, including an oral presentation in a seminar style. That is a short TED Talk, concise talk about a certain aspect of your paper in front of the students, fellow students, as well as anybody that you worked on with the paper. And then again, that is taken in your final spring. So you do get credit for that. That counts towards the 48 units. And then another question we often get is, where do people do their internship or practicum? And here's just an example of the most recent sites over the past 2 years. And you'll see quite a few consulting firms, quite a few places at Kaiser that is very close to us. There's many different Kaiser sites. The big admin organization offices are in Oakland, so it's very close to us. We also have students do internships at Gilead and Blue Shield. We're very close partners with Blue Shield because of the fellowship that Yesenia mentioned earlier in the presentation. Genentech is very close to us, so there's a lot of places close to the Bay Area. So another benefit of Berkeley is our location to all these wonderful places, and so our students tend to be able to find a site that they're interested in and it's close by, or if they want, they can do in practicum outside of the Bay Area. So there's lots of different options. This is just an example. And then very similar to the graph that the image that Lori presented earlier is, where do HPM alum go? All over the place. There is not one specific funnel that our students go to. Students can get jobs in consulting. They can get jobs with provider organizations, payer organizations, go into global health. They can go abroad. Quite a few of our students do fellowships with administration, either in Sacramento or even Washington, D.C. There's quite a few options for that. So our students go a lot of different places. It's a very interdisciplinary program that you're not tied to one specific area or one specific field to go to. So it is very broad. And then what you're really here for is how do you get into our program? Give us some tips and tricks. And so here are some insights specifically to health policy and management. Lori and Derek in the chat talked a little bit about holistic review process, and that includes the GRE is optional. And so for health policy management, I would recommend if you would like to submit a GRE, I would recommend that only if you are a re-entry student, you've been out of school maybe 15, 20 years, or you're changing careers. So you don't have some of that research experience that Lori was talking about with data or with statistical software such as R or Stata, SAS, SPSS, even some of the older software is good experience to have, and you can list that in your resume and in your essays. But that is really, if you're thinking about taking the GRE, consider, do you have something else to prove that you do have those quantitative skills to do well in a graduate level program? And another question we often get is, what undergrad majors come into our concentration? And we see a wide range. There is not one that is a clear funnel into our program. We have students who are international business studies or English. We have a few students with English undergrads. There was somebody, liberal arts, somebody coming from music or art undergrads. So it's a very wide range of academic and professional backgrounds. Another thing that was mentioned earlier was letters of recommendation, and I cannot stress this enough. Please submit 3 excellent letters of recommendation that will give you very positive, glowing, and personal recommendations. So this is part of the holistic review process. The admissions committee will look at the letters and who's recommending. And honestly, these are faculty that are on the committee, so they can tell who is submitting a generic run-of-the-mill cut and paste template of a letter, because they write these letters as well for our students. And so we really recommend to submit from 3 people that know you well. Another thing I would like to add is consider submitting only 3. I think the system allows you to submit up to 5, but the committee might not review all 5. They are definitely going to review 3. So if you have 5, submit the top 3. And another thing that Lori really stressed was the focus on essays, and this is part of the holistic review process. So the essays are looked at. One good question that came in the chat was, are you tied to the word limit? And piggybacking off of Derek's response is, write as much as you can within that word limit, be concise and precise. I cannot guarantee our admissions committee will review if you submit 2,000 words. They might stop at 1,000 words and not review the rest. And if within those words, it's not clear why Berkeley, why public health, or why health policy management, they will move on. And so try to be as clear and concise as you can be about those whys that were mentioned earlier. And another question that comes up is prerequisites for health policy and management. There are no prerequisite courses, but it would help to have if you've had college level math or statistics. Examples are listed here. It would help if you had an upper division, a more advanced than a basic business for math class. Economics would help as well, especially if you're missing some other aspects in your professional background or your shifting careers. You can take an extension class, and that would be highlighted on your resume or in your essays, and we do see that in your transcripts. So a lot of that is taken into consideration, not just your professional background, but also your academic and what other experiences do you have. And another requirement is work experience. So health policy management highly recommends 2 years of full-time work experience. We do not require it, but it does help, especially if you did not come from a STEM or have the academic background of these examples that we gave. But if you have that from your work experience, that's part of the holistic review. We look at everything. So we're checking off, making sure if you're a good fit for the program. Did you get some academics, or did you maybe learn this in your professional career? Volunteering experience would count, doesn't have to be paid. The average work experience for our admits over the last 3 years is 3.3 years. Just to give you an example, we do have those lower than that, and then we have that who are much more advanced in their careers with 10 or 15 years of work experience. So just the average is 3.3 years right now. And then here's some basic statistics over the past 3 years. You can see I pulled this out to talk to in this session is The average applicant pool, so the number of applications we receive, is about 135 per year, but we don't review all those. So those reviewed is about 115 over the last 3 years, because we reviewed those that are completely completed and submitted by the deadline. So when Lori was mentioning submit by the deadline, submit early, this is really, really important. And we are a competitive program. You can see our admit rate here is lower, and then only 40% of those that were admitted accept our program. So our program is small. And so what would really help you to help us is if you submit a completed application by the deadline, it will be reviewed. And then we do have a very diverse cohort. We're very proud of that. We do outreach such as this. We do outreach through other channels and using the wonderful Dream Office and our admissions team here on the call. And so we are very proud to be a very diverse cohort. As I mentioned, we are small. We have 34 current students enrolled in our 2-year program. Those are the incoming students this year and those that are continuing who started with us last year. 44% of those are URM or first-gen college students, self-identified, and that would be the same who would qualify for the Blue Shield of California Fellowship that Yesenia mentioned. We are more heavy on the those who identify as female side. Quite a few come from California, and we do have international students. I think this 11% actually comes out to be 4. 4 of our current students are not US citizens or are coming from a foreign country. And then here's more contact information because you can't have enough, but you can reach Norma and I specifically about the health policy management program and curriculum at hpm_mph@berkeley.edu. If you have questions about the application itself, Lori and Derek are more than happy to help you. And here's their direct email here is the best email to reach them. And then we do have the prospective student ambassadors. And I believe a few of them will be current health policy and management students.